Action.
Okay, so in this video, I'm going to be doing an antepartum assessment. So the first thing that I would do, I would gather all my supplies that I needed. Then I would come in, introduce myself. I would explain to the patient that I'll be doing an assessment, and I would explain to her what the assessment entailed. Then I would identify the patient with name, birth date, identifiers. Then I would wash my hands, put on gloves. I would make sure I provide for his safety, make sure the bed is at a workable height for me, and I would, make sure the bed's at a workable height. Yeah, okay. Also, I'll make sure that my patient's bladder is not full at this time before I get started. Okay, so now we're starting. The patient is back. I would obtain the patient's vital signs. Once I get the patient's vital signs, I will evaluate the patient's weight. After I evaluate the patient's weight, I will have the patient lie back on the table. And after the weight, what I would do, I would assess the patient's skin. I would check for the color. I would check for, make sure I check for edema, especially if the patient's blood pressure was raised. You want to, make sure you check for edema. And after I check the skin, I'm gonna check the patient's nose, mouth, and the patient's neck. And then after I check that, I'm going to evaluate the patient's chest and lungs, like I would do in a regular head to toe assessment. Then I would evaluate the patient's heart. After I evaluate the patient's heart sounds, then I would check the patient's breast and the nipples to check for the size, make sure there's no secretions or anything like that. And after I do that, I would evaluate the patient's abdomen. I would check for color, make sure that it's no bruising. Also, with the abdomen, I would check for the fundal height. I would check for the fetal heart rate. I would check for the fundal height, the fetal heart rate, the fetal position, and fetal movement. Okay. Once I assess the abdomen for those 4 things, the next thing I would do is the Leopold's maneuver, which was done in a different assessment video, as well as the checking the fundus height was done in a previous video. Then I would check the pelvis, check the patient's pelvis and the perineum. Check the patient's pelvis and the perineum. And then I would check the patient's reflexes at this time. After I do the reflexes, the last thing I would check is the signs of labor. So we're checking the signs of labor. The patient's legs would be bent. And when assessing for the signs of labor, you're gonna check to see if the patient's mucus plug has expelled. You're gonna check for lightning and dropping. You're also gonna check for a bloody show. You're gonna check for rupture of membranes. And then you're gonna check for the amniotic fluid. You're gonna check the color and see color and odor of the amniotic fluid. Okay, and once you finish checking that, then you'll be done with the antepartum assessment. Then you want to help your patient get back in a comfortable position. Make sure your patient doesn't need anything, that all of your patient's belongings, cowbells, and things like that are near the patient. And that concludes this video.